As a physician, I found that there are two kinds of people. Those who believe that medicine is going to solve all of their issues, and they're constantly seeking the perfect drug. And then there are those who absolutely hate the idea of taking any kind of medication out of the fear that it will somehow change them, make them become dependent on the medication, or they just don't believe that they should need to take a medication to feel better. And this is especially true in the world of psychiatry, where people mistakenly believe that they are in charge of their brain rather than the other way around. They will refer to medicine giving us a false sense of happiness or the illusion of feeling better. In my experience, you're either feeling better or you're not. There's no illusion of feeling better. But the reality is, medication falls somewhere in between these two extremes. With some notable exceptions, such as antibiotics or chemotherapy, medicine generally helps with symptom control without necessarily curing the entire underlying problem. I'm Dr. Vint Blackburn, and as much as I hate to ask, I would really encourage you to like and subscribe to my channel. As many of you know, I haven't put out much content in almost a year, and by liking and subscribing, you are supporting my channel and reminding me that this content is important to you. I love to educate, but only if I feel like people are out there actually listening. And it is free, so please like and subscribe. It would mean a lot to me. Also, I do read all the comments, and so I'd be happy to even make content based on some of those if they inspire me to do so. Now, going back to the subject. Why is it easy for somebody to take Tylenol for physical pain and yet refuse to take a medication for psychological pain? This has always been an interesting conundrum to me. Just like taking Tylenol will help with the aches and pains of a viral illness, it doesn't necessarily cure the illness. However, it does make it a lot easier for somebody to tolerate the symptoms while the body does its thing, although it can help you from developing a life-threatening fever along the way. So it's not without significant benefit. As a psychiatrist, I prescribe medications, but I still feel strongly that skills beat pills in many circumstances. We know that therapy, especially cognitive behavioral therapy or other forms, are highly effective for anxiety, depression, and even ADHD. Dialectical behavioral therapy is a wonderful tool for people struggling with borderline personality disorders and high-functioning autism, just to name two. But sometimes you have to tolerate the symptoms, or more specifically reduce the symptoms, such as the anxiety or the depression, or the obsessions or the compulsions, in order to actually be able to incorporate and utilize the therapy that you're engaged in. I like to use the analogy of snow tires on a Porsche to help people better understand what I mean about how medicine actually helps. Take attention deficit hyperactivity disorder. Cognitive behavioral therapy has been shown to be very effective. However, if you can't slow down your brain enough to take in the information, or you struggle with concentration, or sitting still, or prioritization, then it can be extremely hard and sometimes impossible to benefit from the therapy. After all, therapy is learning, specifically new ways of thinking or approaching things or doing things. And as anybody with ADHD will tell you, learning, especially a subject that is in any way tedious or challenging, can be exceedingly difficult. So I like to describe my patients with ADHD, for example, as being a Porsche. Now, it's a great vehicle for going very fast on a flat surface like a racetrack or the Great Salt Lake. However, if you find yourself in a snowstorm on a winding mountain road, you're going to find that a Porsche is simply not equipped for this type of driving. Now, let's be clear, that does not mean that this is a crap car. It just doesn't have the right tires or traction for this type of work. However, if it's all you've got to get across the mountain, well, then you have to make it work, or you end up getting hopelessly stuck. Growing up at 7,000 feet in New Mexico and driving a rear-wheel drive pickup truck, you just learned to turn into the skids, to not stop on hills, and a lot of other skills and techniques that could get you from point A to point B. But sometimes, even your driving skills were not enough, and this is when you had to put snow tires or even chains on the car. And when you're first learning to drive in the snow tires are invaluable. Now, I would venture to guess that most of us would feel no shame in putting snow tires on our car when we need them. Once the weather clears, the terrain smooths out, we can take them off and go on our merry way. But snow tires do not make you a better driver. They simply help in tough situations. No matter how good of a driver you are, they may give you that little bit of traction, however, that you absolutely need to get over the pass. And there's no shame in that. Medicine to me is like snow tires. When you need to control your anxiety enough to make it to therapy, or to push yourself through an exposure, or work through a trauma, or to lift depression just enough to make life seem worthwhile, and make therapy seem viable, then medication can make all the difference in the world. In many cases, the medication will be temporary, 6 months, a year, while you move through the depressive episode or work on the therapeutic approaches to avoid them in the future. Sometimes you live in snow country, and you just simply need to leave the tires on all the time just in case. And medicine, in that case, will just be a necessary part of life, such as acid reflux medicine is for me. But it rarely solves all the problems on its own. Nonetheless, when you're spinning your tires and you're not going anywhere, it's only logical to put on the snow tires so you can continue on your journey. That's the smart way to get through a storm, and not something that one should feel ashamed of. As a final note, I always find it somewhat interesting when I'm talking to my patients who use cannabis or alcohol daily, and they'll often admit that it's for their anxiety or their racing thoughts, and they will tell me, I don't want to be dependent on a medication. But that's a whole other discussion. Now, please, don't make me beg, but like and subscribe. It makes a huge difference for me. And remember, mental health and physical health, they're the same thing.